Hello, it's Dr. Garrett Pullman, host of the Prostate Health Podcast. Today we'll be focusing on advanced prostate cancer. Joining us today on the podcast is Dr. Elizabeth Wulff-Burchfield from the University of Kansas Medical Center, a dual specialist in both medical oncology as well as palliative care medicine. So stick around. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is the question, and this podcast will provide the answers. On a weekly basis, we will be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pullman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. So joining us today on the Prostate Health Podcast is medical oncologist Dr. Wulff-Burchfield. She attended medical school at Duke University. She then went on to complete her internal medicine residency and fellowships in both medical oncology and palliative medicine at Vanderbilt University Medical Center. She's an assistant professor at the University of Kansas Medical Center, and her specialties include genitourinary oncology and palliative medicine. Her clinical research is focused around genitourinary cancers, as well as the intersection of genitourinary cancers with supportive and palliative care. Dr. Wulff-Burchfield, welcome to the podcast.
Thank you.
So can you tell our listeners, first of all, what is advanced prostate cancer?
Well, I think this is a definition that's changing rapidly, and in part because of our ability to stage prostate cancer is changing so much. But generally, I think of advanced prostate cancer as being someone who has prostate cancer that has really spread outside of the prostate itself and the lymph nodes really right around the prostate in the pelvis. So kind of even lymph nodes right outside the pelvis could be considered advanced prostate cancer, and usually is. And certainly if it spreads to other tissues in the body like bones or other organs, then we would consider that advanced as well.
Certainly. So for someone with this advanced prostate cancer, are they typically candidates for local treatments of the primary tumor, such as surgery or radiation?
Well, that is also changing. You're going to hear a theme there, which is that things are in flux in a good way, just because we're getting so much new technology, so many new treatments, and asking so many important questions on the research side for people who have advanced prostate cancer. So I would say historically, no, we haven't found that men who have advanced prostate cancer seem to derive as much benefit from treating the prostate itself. However, there have been some studies that have been completed already that showed some conflicting evidence, some in favor of men deriving benefit from treatment of the prostate itself, and some that are showing less impressive benefit. There is currently a national clinical trial ongoing through the SWOG Cancer Research Network that's asking that very question and randomly assigning men to either get treatment of the prostate itself along with standard treatment or to just get standard treatment. But I think that keep your ears to the ground, because that's going to be changing over the next, 3 to 5 years.
So can you talk about some of the different diagnostic tests that are utilized in determining when prostate cancer has spread beyond the prostate?
Sure. So historically, we have used a lot of two main imaging techniques. One, which would probably be CT scans, CAT scans. The abdomen and pelvis is the most important area for us to image to see if there are suspicious lymph nodes that are larger than a typical size of lymph node that might suggest they have prostate cancer in them. Also, we use something called a nuclear medicine bone scan. That's different than something you may have heard of, some of the listeners may have heard of, like a bone density test, because it's not really looking at the strength of the bones. It's looking at whether there are areas where new bone is being laid down in a way that looks pathologic and abnormal. There are new imaging techniques, some of which are approved already that people may have used or heard of, things like certain types of PET scans. One is called a choline scan or a C11 scan. There's one called an 18-fluciclovine scan, which is the brand name is Aximin. And there is one that is soon to be approved, we think, which is a novel type of PET scan using a protein called PSMA. That hasn't been approved yet, and I think will be in 2020.
So certainly a lot to look forward to. So men with advanced prostate cancer often have no symptoms. And as we discussed, these are discovered, or this advanced prostate cancer is discovered with various imaging tests. For those men that do have symptoms of advanced prostate cancer, what are some of the symptoms that they may experience?
Well, there's a wide spectrum of what men can experience. And you're right that it's amazing to me that I have men coming to my clinic every week who don't have symptoms of their advanced disease. And to be clear, we're happy for that. We don't want people to have symptoms, although I'm sure it makes it harder to reconcile what they're hearing from their doctors and kind of their staging. So generally, if men have symptoms from their prostate cancer, it could be local symptoms in the pelvis, such as difficulty with urination, erectile changes, sometimes or rarely bleeding in the urine, but people can have symptoms of the sites of metastatic disease. And I think we're going to get into this a little bit later, but given the natural behavior of prostate cancer and the higher likelihood that it could spread to bones compared to some other diseases, some men present with pain, either pain in their spine or pelvis, pain in new locations where they've never had it before. That can be a concern. And with all cancers, things like severely worsening fatigue, unexplained and uncontrolled weight loss. And those are some systemic symptoms that sometimes people have.
Now, what are some of the goals when approaching advanced prostate cancer?
Well, our goals are to help improve or prevent or delay cancer-related symptoms, as well as to help men live longer than we would expect them to if they didn't get any treatment of the prostate cancer.
Now, for our listeners, could you kind of go through some of the more common initial treatments that we use for advanced prostate cancer?
I'd be happy to. So historically, the backbone of all prostate cancer treatment, and for a long time, the only treatment that we would do initially was hormone manipulation of some kind or another. Because prostate cancer starts out at least as a hormonally fueled cancer by androgens, male hormones, a lot of the treatments have revolved around us depriving the cancer of those. So by decreasing production of them. And until 2014, the standard of care was to do that through only one type of treatment at a time, and then to use all the existing and approved treatments that we had sequentially. And now we often will do sort of paired treatment with a medicine that accomplishes that and lowers testosterone levels, paired with one that either does that through a separate mechanism, blocks testosterone receptors, or even chemotherapy.
Definitely some excellent information so far regarding advanced prostate cancer. We're going to take a quick break here, and we'll be right back to continue our discussion. Thanks again for joining us today on the Prostate Health Podcast. If you're enjoying the show today, make sure you visit my podcast website at www.prostatehealthpodcast.com. There you can find show notes to all our episodes. You can also click on our resources tab, where you can find links to our trusted partners of the podcast, as well as links to books, resources, and products, all of which can help in your journey with either an enlarged prostate or prostate cancer. You can also sign up to receive my free What to Expect guide, which includes checklists of what you need to bring and how to prepare, including what to expect with 3 different scenarios, including your initial urology clinic appointment, a prostate biopsy, or prostate cancer consultation. Sign up for the free guide on the homepage of www.prostatehealthpodcast.com, or access this guide directly at www.prostatehealthpodcast.com/clinic. Now, along with some of the initial treatments come side effects, as you well know. And could you explain some of the side effects or some of the more common ones that we see with this hormonal therapy?
So generally, I think that the hormone-related sort of symptoms related to hormone manipulation fall into a couple of categories. One, I would say, is temperature dysregulation. It doesn't typically affect the temperature that we take if we use a thermometer, but a lot of men experience hot flashes and night sweats, and sometimes this sort of in-between syndromes where they'll feel just uncomfortably cold or uncomfortably hot at room temperatures. That's common. As you can imagine, if we're manipulating hormones, then people's mood can be affected. So some people can feel irritable or just more emotional or moody or just feel out of sorts in general. We can also see that by lowering testosterone levels, erectile dysfunction is very common. And then there are some longer term effects that may or may not have symptoms associated with them, but some men experience kind of a decrease in muscle bulk over time. And we can even see sometimes a decrease in bone strength or kind of the vitality of the bone structure over prolonged time. And that may not have symptoms, but sometimes it can if people get kind of a loss of height or even compression fractures.
Certainly. So Dr. Wulff-Burchfield, can you tell our listeners what it means when we start seeing the PSA start to rise despite being on this hormonal therapy? Because, as we both know, that we expect to see that PSA decline when they start this therapy, but at some point we start seeing that PSA go up again.
Well, having PSA being something that we can detect and serve as a tumor marker is a double-edged sword, as I'm sure you know and have experienced, and so have many of our listeners and our patients, because it gives us our ability to put our finger on the pulse of the disease in a way that doesn't exist with a lot of other cancers. And so we can see even minute changes that can suggest positively or negatively what the behavior changes are that we're seeing with the cancer. So when PSA starts to rise after patients have either had a stabilization of it or more commonly a decline in it on treatment, usually means that the cancer has found a way to grow in spite of needing testosterone and other androgens as fuel.
Now, with that kind of resistance to the hormonal therapy, I was going to see if we could just go through some of the options that are available for these men once they've been found to have this rise in PSA and resistance to the hormonal therapy.
Yeah, I'd be happy to. So as I mentioned, so many patients now are starting on doublet therapy where they get a testosterone lowering agent paired with another. So take this with a grain of salt because depending on what a given man starts with, some of these options may not make sense to do at the point of developing resistance to this initial hormone manipulation. But there are several medication options as well as some other types of treatments. So there is one medicine that's effectively kind of an immune therapy or kind of an immune modulator that exists called Sipuleucel T. And its goal is to try and help your own natural immune system recognize prostate cancer proteins and antigens better so that your own natural immune system might be able to attack prostate cancer cells. That is for men who have essentially metastases to bones only and really don't have symptoms from those, at least to such an extent that they need medicines for pain, for example. Other options are kind of advanced hormone manipulation techniques. So there are several that are approved, and one would be abiraterone, and that medicine essentially decreases production of testosterone precursors from other tissues in the body, like the adrenal glands, even prostate cells themselves, fat cells, which have these other enzymes that make testosterone precursors. So Zytiga or Yonsa or abiraterone, they're all sort of one and the same in different brands and formulations. They can all diminish those testosterone precursors from being made. Enzalutamide is another treatment, and enzalutamide is more of an androgen receptor blocker. So it just kind of plugs up the androgen receptor so that the prostate cancer cells cannot feel the presence of their fuel there and might be able to block even the most minute levels of any male hormones from serving as fuel. There are also some other things like chemotherapy. There are two that are currently approved and favored, which typically have to be given in order, not one consecutively right after the other necessarily, but typically payers need us to use docetaxel first. And then there is another called cabazitaxel, which are both given as an IV drip or an IV infusion every 3 weeks. And then there is another agent, which is a really neat kind of treatment, radium-223, which is kind of this medicalized version of radiation that is targeted or taken up more in bones. And so if men have metastatic disease to bones, then it can target the radiation to those areas in hopes of killing some cancer cells that have lodged or taken root in the bones.
So certainly a lot more at our fingertips now than we used to have, correct?
Absolutely. It changes every year, more than that, really.
And another question that comes up from some of my patients is, you're putting me on some of these additional therapies because there is some resistance to the therapy. Do I need to keep taking the shots, the Lupron, to suppress my testosterone level?
I get that question a lot too. And generally, we do recommend continuous use of testosterone-lowering treatments because we have to assume that there are probably some prostate cancer cells that are actually controlled by them. And so even though I would love to spare my patients from getting another injection, another treatment, another copay, it would be far worse in our view to essentially unleash cells that were dormant. So we do recommend continuing that.
So in summary, as you discussed, the treatment options for advanced prostate cancer is constantly evolving and changing. We certainly have more at our fingertips, like we mentioned, than we did in the past. So any final thoughts for our listeners today?
Well, any of you who are impacted by prostate cancer, either personally through a family member, please know that the landscape is changing rapidly and there is so much room for hope about your quality of life, about vitality, about length of life, and about having more time to spend with those that you love. I do think that clinical trials can be a really important way for all patients to get access to treatments that aren't yet approved and to be someone on the leading edge of science. And so while it can be really intimidating to think about participating in a clinical trial, that's how we move the needle, so to speak. So that's something to discuss with your medical team to see if it applies to you and if there are options there in addition to those that I've described, because many times those clinical trials can add essentially other lines of treatment that aren't yet approved and can give even more options.
Well, thank you for joining us today on the Prostate Health Podcast. You've really certainly given our listeners a lot of valuable information today that will help empower them. Thank you again.
My pleasure.
Thank you again for listening to the Prostate Health Podcast. We would love to have you join our podcast Facebook group at www.facebook.com/groups/Prostate Health Podcast, or just use the Facebook group search function and search for the Prostate Health Podcast and ask to join. We'll see you at the next episode.